World AIDS Day on December 1st brings together people from around the world to raise awareness about HIV/AIDS and demonstrate international solidarity in the face of the pandemic. The day is an opportunity for public and private partners to spread awareness about the status of the pandemic and encourage progress in HIV/AIDS prevention, treatment and care around the world. In light of this, we speak to Bada Pharasi, CEO of the Innovative Pharmaceutical Association of South Africa, for more insights. Bada, I appreciate your time. Now, there is a number, in fact, three numbers, 95, 95, 95. Let's start there. What is the significance of these three numbers?
Good afternoon, Hugo, and good afternoon to your viewers. The significance of the 95, 95, 95 figures is that UNAIDS intends to, by 2025, have 95% of people with HIV knowing their status, and 95% of people who know their status being on treatment, and then 95% of people with HIV who are on treatment should then be virally suppressed. Virally suppressed means that the virus is hardly detectable and they can actually have sex and not necessarily infect their partners, although no one is encouraged to do that without protection. But that's the significance of the 95, 95, 95 figures.
Now, access to treatment has been identified as a factor hindering efforts to eliminate HIV. Now, in your opinion, what strategies can South Africa implement to improve access to HIV treatment and move closer to those 95 targets?
Actually, there has been a problem, and it largely has to do with stigma. In the first instance, when people go to clinics or hospital outpatient departments, you will find that there's a particular clinic on a particular day of the week where people with HIV go. Now, few people want to be seen to be in that queue. The result is that they don't go. The other problem is that you go to a clinic within your neighborhood and you are seen by the senior nurse who happens to know your parents. Those kind of things. So people rather stay away. So what happened is that the South African Pharmacy Council then decided to apply for pharmacists to undergo training that would allow them to also prescribe HIV medication. Now remember, HIV medication is scheduled from Schedule 3, 4 higher, which means that it can only be prescribed by a medical doctor. But with the necessary training, pharmacists will now be able to prescribe HIV medication for patients. So if you go to your pharmacy, where you stand at a cubicle in the safety of the pharmacy, knowing that no one else can hear your conversation, your secret is safe with the pharmacist, and the pharmacist is able to then prescribe HIV medication once you have undergone the necessary tests. Now, a group of doctors had actually gone to court to try to stop this, and a few months ago, the court then delivered its verdict, saying it was okay for pharmacists to do that. So that is one thing, one way of increasing the number of people who will go and test and have medication. The other one, of course, is that from people having to take medicines about 2-3 times a day, these days we have medication that's combined therapy, where it's a combination treatment, where you need only take the pill once a day. And that actually encourages people to not forget to take their treatment. However, of late, an injection has now been developed, which means that you can have a jab of the injection on the bum, and that will last for 8 weeks. Actually, let me see, 8 weeks? For 2 months, yes, 8 weeks. So you need only take that every 2 months. The problem, however, for the South African government is that at this stage, because this drug is still new, they say that it is unaffordable. They will not be able to supply it to patients. As you know, most patients who go to government clinics and hospitals do not have to pay at the point of service. But the government says it will not be able to afford this. So they are still in negotiations with companies that will be able to manufacture the drug in South Africa, in which case then it will be much cheaper.
Well, but many of the things that you speak to the stigma, the HIV-related stigma, which remains an issue, even though improvements have been made in South Africa. What do you think stigmas are still attached to the virus, and what can be done to further reduce the stigma? I mean, it's easier said than done. Obviously, we talk about individuals like you and I. We might be friends or on the street, and that stigma associated. But, I mean, you gave the example where a nurse would see her friend's son and then be surprised or go around and tell everyone. So it appears even in the medical fraternity, based on that example, that there is still a stigma associated with HIV, particularly when we know the individuals.
Yeah, well, in the first instance, it seems that some people believe that only certain groups of people can get HIV. And they then tend to pass moral judgments about people who take steps to prevent HIV transmission. Remember, HIV is not only transmitted through sexual intercourse, it can also be through blood transfusion. Or it can innocently be transmitted when you unknowingly had intercourse with someone who is infected and didn't know their status. So it's not, people should not be judged to be immoral, to be loose, to be of loose sexual morals. It simply means that actually it's nobody's business how one did get the HIV. We just have to understand that there are various ways through which people can have this transmitted. And the fact that they are actually going through a treatment should be enough to give them the respect that they deserve, because they do not want to infect anybody else and they want to stay healthy. So there are all sorts of ways that we can avoid the stigma. Let us have clinics, or those days in the hospital or clinic where you don't segregate people who have HIV. Let everybody join the queue, and no one will be able to say, those are the people with HIV. Let everyone be treated, and people must understand we should get involved in talking with family members, with friends, and explaining to them, look, if you suspect that you might be positive, just go and test. If you want, I'll go with you. You have healthcare professionals who are trained to deal with you, to give you counseling. It is just as a disease like any other one. You don't have to fear anything. We really need to give support to those who are brave enough to come up and come up for diagnosis and eventually treatment.
Now, when we talk about the attempt to reach these figures of 95, 95, 95, there are obviously various communities that are infected by HIV, and one of those communities is the queer community. Now, just how difficult is it to achieve those numbers in the queer community, particularly when we take a look at issues around stigma? And in a number of conversations that I've had, they're exposed to a greater amount of stigma than just ordinary members of our society that might have HIV and AIDS.
Yes, unfortunately, the stigma in this case is attached to the fact that these are queer people, which is unfortunate. However, I would say that South Africa is fortunate in that, unlike a number of other countries on this continent, South Africa actually does not sneer upon people with people who are queer. I know of a number of countries on this continent where it is illegal to be to be queer. And what happens is that such people cannot go to a medical facility to get treatment or to be diagnosed if they fear that they might be infected. And any doctor who comes across a patient who is queer is supposed to report that patient to the police. So we fortunately do not have such laws in this country. So people with LGBT are really well protected by our laws, and they need to have no fear of any stigma being attached, which would be a double stigma actually. First of all, having HIV, and secondly, being LGBTQ. This is something that in our country, I think we're very, very fortunate. There might be a few people who still have that kind of attitude, but I would say that by and large, they're quite safe in our country.
Now, considering the advancements in technology and innovative medicines, do you believe that the future of HIV treatment lies in these advancements? I mean, can technology contribute to achieving the 95-95 targets?
Absolutely, absolutely. People have been asking, when are we going to have a vaccine for HIV? Well, I can tell you that scientists have been working on this vaccine for quite a long time. This is a virus that has really defied all sorts of odds. And I must say, just like anything else that has come before HIV, we had the plague decades ago, we had all sorts of other viruses that killed people in numbers, in hundreds, in millions. The cure for AIDS is going to come through a vaccine. And once that happens, we will look back and say, to think that many years ago, people used to die like flies because of this. But once we have a vaccine, this is going to come to an end. So vaccination, innovation is the way to go. Innovation will definitely lead to a vaccine being developed, no doubt about it.
Now, you've touched on this a little bit a while ago, but, in light of the recent developments, such as the CAB-LA injection, what role do you see for innovative pharmaceuticals in transforming HIV prevention and treatment approaches in South Africa? Is this likely to encourage people? I mean, it's costly, as you say at the moment, but as it progresses in development, is it likely to be a contributory factor in reducing the incidence of HIV, or certainly for those that are being treated?
Yes, it will be. Any new innovation is initially costly at the beginning, but what's going to happen, if you look at the drug that's being produced by the injection, that's going to allow one to take a jab every 8 weeks. What the British company that's producing this is doing is that they are going to make it available through what is known as a patent medicines pool, medicines patent pool, which allows any generic medicines producer to get a license through that unit, and they will then be able to produce it. There is a company, I won't mention their name, they have a facility in South Africa, and they are looking at producing that drug. Of course, it's going to take some time. It might take 2 to 3 years. That's one way of ensuring that the drug becomes accessible and cheaper to South Africans. The other way is the innovators of the original product, if they are allowed by the South African government to reduce their drug to those patients who cannot afford to pay the initial price, then we will also see access being increased and improved for those who need it. So it will happen.
Now, financial resources play a crucial role in achieving ambitious targets like the 95-95 goal. How can public-private partnerships contribute to securing the necessary funding for scaling up HIV testing, treatment and prevention efforts in this country?
We saw how collaboration between government and the private healthcare sector actually managed to get a lot of people being helped through COVID in the years 2020 to 2022 when we had COVID-19. The private sector played a huge role in ensuring that all the treatment, all the diagnostics that patients needed were moved to where they were needed. That kind of collaboration needs to continue. We need to have public-private partnerships continuing. I think what we've seen is that government cannot be expected to do things on their own. The private sector has the resources, they have the means, they have the expertise. Let government allow them to come in, and I'm telling you, what we are going to achieve as a country is something that would never have been expected in the past. And I believe the future really lies in this public-private partnership, collaboration between the public sector and the private sector. That should happen.
But you raise an important issue, and that's the issue of COVID-19 over that 2-year period or so. Just how much did it pull us back in achieving these 95-95 targets? Because it was a challenge, I suppose, the first part of the question. And that second part speaks to accessibility to treatment. There are obviously many individuals that may become infected by HIV, but ordinarily would not have immediate access to antiretrovirals or the medicines that they should be taking.
Well, unfortunately, as we know, during the COVID era, what happened is that hospitals tended to focus on receiving patients who needed to be treated for COVID-19. And that means patients with chronic conditions, including HIV and TB, didn't get the priority that they needed. Unfortunately, it meant that a lot of people who should have been given treatment didn't receive it at the time. And that was a bit of a setback for us, for those patients. But I believe that from the experience that government has gained through that, any future pandemic will be something that government would have gained the necessary experience and strength to deal with. And of course, we still have people who still do not believe in going to the clinics for fear that priority will be given to those with COVID. But I think that is past us. That was an unfortunate period, but I believe that it's something that is not going to happen again. Experience is really a true teacher to all in the public and the private sectors.
Now, when we talk about advocacy, just how much advocacy is being done around HIV? And I'd like to focus on two areas. One of those areas stems from a number of conversations I've had with health personnel who speak to a number of individuals that have HIV but are reluctant to take their medicines because they feel good. You know, their health is okay. They're not struggling. So I don't know if they think they're cured, but many of them seem to think that because they're in a good state of health at that particular juncture, it isn't really necessary. And then secondly is around infection, maybe even reinfection. Just how much advocacy is being done towards young people, educating them, particularly those that are having their sexual debuts and may not be fully in the know on issues around sex or sex education, for instance?
Well, in terms of advocacy, I would say that a lot more still needs to be done. Unfortunately, among the young, there is this belief that even if you have a new sexual partner, there is simply no need for you to protect. And protection, the best protection, obviously, is through the use of condoms. People believe that the use of condoms doesn't really give them the satisfaction that they require through sexual intercourse. And unfortunately, until such time we get to have people educated enough to realize that before you have sex with anyone, any new partner, one, you need to be tested. Until such time that both of you are tested, you just need to have that protection. And condomizing is the best way of doing that. The other thing is that advocacy groups, and for every condition of illness in the country, we do have patient advocacy groups. They need to be supported by government, and when they work with government through radio, through all sorts of other media, public media, we have to continue beaming out those messages to let people know that even if you get a vaccine, even if you have a drug, that means you can take it every 2 months instead of on a daily basis. You are not completely protected. You have to continue safeguarding yourself by protecting and by ensuring that you test. Even if you have the slightest suspicion that you might be infected or your partner might be infected, you just need to talk to them. But it's through advocacy that people can get to understand that HIV is not something that kills. It can be cured, and people will understand why you come forward for treatment as long as we give the necessary messages through advocacy.
Now, you've talked about testing and its importance. Home testing kits are obviously now readily available in pharmacies. But one of those issues that always comes up is the cost of home testing kits, the cost of preventative measures such as condoms and so on. Is this an issue, do you think, in the prevention of HIV, that those items still come with a price tag that many are unable to afford, particularly when we take a look at young people, for instance, or even those that are unemployed?
No, it's not an issue at all. First of all, in terms of availability of condoms, if you go to most government buildings, you will find that in the bathrooms, there's a box of condoms. You can take as many as you want. It's not only in clinics and hospitals where you get free condoms. In many government buildings, you can go to get those. So there's no issue at all in terms of availability of condoms.
But it raises but it raises the issue though of that advocacy that we're talking about. Just how many people are aware of this information? Right? I mean, it's government.
Well, it might be, yes. You do have a point there. It might be that not enough people are aware. And I think that's one of the things that need to be done by the advocacy group and government, to beam those messages through radios in all languages to let people know of the accessibility of condoms in government departments. And it should not only be in government departments that you are able to access condoms. It should be in any building that's accessed by members of the public. Now, as far as testing is concerned, you can go into a pharmacy, you can go into a private clinic and be tested. If that's expensive, you can go into a public sector clinic and be tested for free. The thing with do it at home testing might be that once you realize that you are positive, the burden of that knowledge might just drive you to do things that would have been unexpected. So it is best to go in the comfort of a clinic where you know there's a healthcare worker who will give you the necessary support and counseling if your testing turns out to be positive.
Bada Pharasi, CEO of the Innovative Pharmaceutical Association of South Africa, IPASA, appreciate your time this afternoon. You're watching News.